You're here for some laser treatments,
Okay.
and you do have back pain for quite a long time.
Yeah, chronic.
How long, if you want to, how many years, since when?
I'd say, again, it started since when I had that first car accident when I was 7, but then it was 1981 when I really slipped the disc.
Okay.
They treated me for a while. They finally put me in the hospital to immobilize me. They treated me with, I think, steroid injections and just plain bed rest, and then I was out of work for a full year.
So since 1901, almost like 29 years, on and off, pain symptoms come and you get a little better, and then the pain symptoms
Depends
come
on
on.
if I start exerting myself. You sit on a tractor too long. Anything I do too long that aggravates that, any beating or hammering or anything. So I've always had the kind of tendency to mitigate or limit what I do.
Okay, now we're going to do some clinical exam, narrow this pain to where it is, and then give you some laser treatments. Why don't you stand up? Let's see how you. So it's a little difficulty in trying to come up. All right, turn around. So that one doesn't hurt when I actually press here. Is that correct?
No, not there. No.
And then, but when you do lean back,
Yes.
you start hurting here. Okay. And then you also have pain here. That's right. And here, and then here.
There.
All right. So with the laser, we're going to treat the whole area here, and we'll ask you. We'll do the same test, like bending back and everything, and you tell us, how you feel.
Okay.
All right. Good. This is a laser procedure using low intensity laser ablation, and we do have a patient here, Jim. You can hear me, right? And he is pretty awake. He's not sedated, and this is all done with the patient awake. Sterile prep and draped here completely, and we can see all the laser points are marked. He does have spinal facet pain, right SI joint pain, hip pain, and greater trochanter pain. We're going to treat all these areas. It's sterilely prepped and draped, and this is a sterile needle here, and we're going to demonstrate the light coming out from here. We're going to do this several times. Again, just to show here. Comes by facet again. He's pretty awake. Jim, I'm just going to going to feel a small prick here, just to show this is pretty benign, and although it's invasive, it's pretty tolerable. Feel a sharp prick here, and that is it. If the needle is very sharp, so you barely even felt it. To get this directly in here. Just right. So right there is at the L5 facet, and you can show the and we are done. So we're going to continue to do all the areas until we are done with the entire procedure. Cut. So and also show the needle standing right. Okay. Jim, why don't you sit down? You just now had the laser treatments.
Yes.
Do you have any pain right now?
No.
No pain at all?
No.
All right, why don't you show us how you get up from the chair? Wow.
The legs up behind the chair a little bit.
All right, why don't you, turn around. So I know this, when you're backward bending, really, was troubling you. Why don't you bend back? Do you feel any pain?
No.
All right, so why don't we twist? Because bending back is not enough. I want you to twist to see if you have any pain. All right, run out and twist here to see if you have any pain. There's no pain. And then there's no pain here when I actually press.
No,
No. All right.
no.
All right.
And there was a few spots, sometimes it'll make me jump.
Mhm.
But
It's not-
today's one of my better days, actually.
Okay. All right, so we'll keep our fingers crossed and we'll
And,
see
you know,
you.
habit is that doing that, but
Uh-huh.
gosh,
And you were not able to get up like that briskly, right? Yeah. Okay. And how many years it's been since you got up like that?
20.
20 years? Oh, all right.
20 plus years probably. As I've gotten older, it's gotten to where you
Okay.
depend on, give it a little help, you know.
Mhm. All right.
But-
Okay, so. So, it's a little difficulty in trying to, in the chair. Wow, and then, but when you do lean back,
Yes.
you
Yes.
start hurting
Yeah.
here, okay. And the backward bending, really, was troubling you. Why don't you bend back? Do you feel any pain?
No.
All right, so why don't we twist, because bending back is not enough. I want you to twist to see if you have any pain. All right, run out and twist here to see if you have any pain. There's no pain.